Good evening, everyone. Thank you for joining us on this webinar. And as you may be aware, today we're kickstarting a series of webinars under the hashtag Redefine Expectations series. You will also recall that on May 29th, ALA kicked off this Redefine Expectations series. Number one, not just to showcase some amazing ALA alumni who are doing amazing work across the world, but secondly, to literally put a statement out there in the world to tell people that we need to raise the bar and we need to raise it high, and we need to raise the bar in Africa. Shortly, we're going to hear from our Dean, Hatim El-Tayeb, telling us why we need to do this. Because when expectations are low, mediocrity thrives. Let's watch this video where he tells us a bit more about this.
We have reached an inflection point as a continent. We aspire to good governance, great education, functional healthcare, thriving industries built on critical infrastructure, and the full realization of individual potential for all. We know that our future will be shaped by young people who commit each day to thinking differently, to breaking boundaries, and to doing hard things. Where expectations are low, mediocrity thrives. We must not simply set higher expectations. We must redefine our expectations entirely, recognizing that the opportunities and possibilities of Africa are limited only by our imagination and our commitment. At African Leadership Academy, we believe that young people can dream big, take action, and change the world. Our youth are not only our hope for the future, they are our leaders today. They will be Africa's greatest generation. Together, we will redefine expectations.
And to kick off this Redefine Expectations series, today we are going to be focusing on shaping the future of health and science, emerging leaders, and breakthrough research. I have an amazing group of panelists with me, three amazing alumni. They have 99 problems, but low expectations is not one of them. Dean Hatim will be happy to hear that. And I'd like to introduce them real quick. They have amazing resumes. You want to hear more about them, I highly recommend that you watch the videos about them that have been made. My first guest is an alumna from the class of '08, Mademoiselle Oyindamola Adefisayo. She is from Nigeria. She is a researcher currently in her 6th year of PhD in immunology and microbial pathogenesis at the Weill Cornell Graduate School of Medical Sciences. Her research is centered on finding cost-effective and time-reducing solutions to the treatment of multi-drug resistant tuberculosis. I highly recommend that you watch the video where she tells us a lot more about her work. Welcome, Oyin. My second guest is Mr. Kwasi Adu-Berchie from the class of '09, hailing from Ghana, a researcher in the field of immunotherapy, seeking to find effective and accessible treatments for cancer. He's currently studying towards a PhD at the Weiss Institute for Biologically Inspired Engineering at Harvard University. Kwasi, welcome. Last but not least is Miss Gift Kiti from the class of 2012. She's from Kenya. She's a public health specialist, currently serving as a data science fellow at the University of California, Berkeley, where she recently graduated with a master's degree in public health. She's done work with Doctors Without Borders in Cameroon, with the Clinton Health Access Initiative, as well as the Jacaranda Maternity Hospital in Kenya. Gift, thank you for joining us tonight. All right, before I get started with you guys, and feel free to unmute your microphones now, I just wanted to give the audience a few pointers We do want you to interact. There is a Q&A option at the bottom of your screen on the right, I believe. You have any questions throughout the conversation, please feel free to drop them in there. If you see somebody's question and you like the question and you really want us to answer that question, like the question. It will climb up, so you will upvote the questions, and then at the end, we will take some of those questions. There is a chat room as well, I believe. If you want to chat among yourselves, you can do that, but at the same time, obviously, you know, pay attention to our panelists. Panelists, once again, welcome. We have a lot of ground to cover. And I just want to quickly give our audience a sense of, you know, what we will be discussing. Sort of the arc of our conversation today is going to be just, you know, it would be irresponsible of us to not acknowledge that we are currently in a pandemic. So we want to talk about a little bit about what does that new norm look like for us. And then we'll shift quickly into looking at Africa-specific problems in the field of health and science. And then, of course, we are eternal optimists. We want to look at some Africa-centric solutions as well. Does that sound like a good plan to you guys? Yes? All right. Without any further ado, I want to bring Oyin into the conversation. I mean, I think it is evident that, you know, this pandemic has forced many industries to really take a hard look at themselves, right? And has disrupted quite a few, education notwithstanding. But before all of this happened, I'd like to believe that there were already some existing breakthrough trends in scientific, obviously inclusive of health research. Can you maybe briefly comment on that for us?
Absolutely. Prior to COVID, I would say that the influence in healthcare and scientific research has primarily come from the idea of personalized medicine, which feeds into this idea that one's environment or, you know, individual genetic changes can make a big difference in terms of disease progression and response. And so, you know, that has shown quite a lot of influence in the fields like where Kwasi is in, like cancer immunotherapy. There's a lot of work that is going into understanding how the diets that one has an effect on cancer and other types of infectious disease progression and treatment. And there's even a lot of work now, majorly in computational science, to synthesize large amounts of data and look for the small differences that really make a difference for an individual or for a group of individuals, you know, regardless of where they're from.
Mm-hmm. Kwasi, it's been what, 3 to 4 months now that we are in a pandemic. We've seen some sectors innovating. We've seen some sectors struggling to innovate. We see some sectors realizing that if they don't innovate, it might spell the end for them as an industry. I'm curious to know, is there currently a silver lining for health and science at the moment? Are there any sort of new opportunities that this pandemic has brought forward, or even just new priorities that are emerging right now globally?
That's a very good question. There is a silver lining, and I would probably describe that on the global front and also on the African front. So in the global front, one of the things that have significantly changed is the speed at which we share information. So before the pandemic, usually for scientific information to proceed, you go through a traditional method of a peer review process. And that peer review process can take many months. And you realize that in a pandemic, that is really not what you'd want to do. So now people are finding innovative ways of fast tracking. One of them is by using what is called preprint, which is pretty much sharing information without the peer review process so that people, the scientific community, will be able to take the information, digest it, and use it. And even for peer review, now there are some journals that are trying to fast track the process so that the turnaround time is high. But they can also think about it that the downside with that is that maybe the quality control process might not be as great. And so you have to find a fine balance between speeding information but still maintaining quality. And quickly on Africa, I've learned during this process really the power of will and focus in responding to COVID-19. I'll use Ghana as a case study. So currently, Ghana has about 10,000 coronavirus cases with 48 deaths. So that is a bit less than 0.5% mortality. And one of the ways we're able to do this is that they develop really strong and really stringent contact tracing and isolation mechanisms. They were able to talk to stakeholders. So there was like very strong kind of public healthcare system focus. And then also they focused on upscaling the production of personal protective equipment. They invested very, very heavily in research. And so I think that by doing that, you have been able to show that if we are pushed, we can do something. And I hope that some of these systems that are already in place can be utilized for that ailment post-COVID-19.
I see you did a little plug for Ghana there. Well done.
Yeah.
But I'm going to use that. I'm going to use that to transition actually to talk about the continent. And I appreciate you sharing, a very positive story, and we will get to those in a second. But I think there's no doubt that when we talk about health and science on the continent, there are many challenges as well. So I'm going to spend a little bit of time to just talk a little bit about some of those challenges. And Gift, I want to bring you in on a topic that I know you feel very, very strongly about, and that's the topic of health inequity. I know that you have genuine concerns about health inequity, obviously in the world, but primarily in Africa. First of all, can you maybe just share for our audience, what is health equity? Why does it matter? And in other words, what are the consequences of health inequity in the world and in Africa?
Yeah, thanks, Veda. By health equity, we mean that everyone has the opportunity to attain their highest level of health. And inequities are created when there are barriers towards accessing these, conditions. And when we think about inequity, we think about the issue of affordability. Not everyone is able to access healthcare. And COVID has actually exposed some of the fragilities within the African health system, because right now the poor are not even able to access treatment. When you think about, the testing, it's mostly accessible to the rich. And when we think about people who are forced to stay at home during lockdown, and maybe they have other conditions going on, and World Health Organization has actually approximated that the number of deaths due to malaria this year are going to double. And that's because while we're dealing with the pandemic, we also have other health fractures in our system. And so if we are not able to handle the issue of health equity from the bottom, then we're all going to suffer, because if we have people who are not healthy, that means our workforce is also not healthy, and everyone in the society is going to end up unhealthy in the process, and we're going to pay a great price for it.
It sounds to me that you're saying that the socio-economic divide on the continent and across the world is what contributes significantly to health inequity. And that issue has been around for a long time. What do you think we need to do and can start doing to try to bridge that gap?
Yeah, I definitely think we need to strengthen our health systems. Like I said before, like with COVID, for example, pre-COVID, we had our politicians, whenever they got sick, whether it was cancer or dialysis, diabetes, they'll run abroad to go and look for healthcare solutions. But now we're all stuck with each other. So we need to strengthen our health systems so that when crisis hits, we are actually able to come up with our own solutions for our problems.
But what's preventing us from getting there? It sounds pretty straightforward.
Corruption. Corruption. I know corruption is a huge disease in the African continent, and the consequences of corruption in the health systems are huge. I can't tell you the number of times with the health clinic that I'm currently involved with, I've had to wait for months or have to go through multiple people. This one wants an incentive, this one wants this. And the people are suffering because if we're not able to provide the immunizations, the family planning services, etc., people on the ground are the ones suffering. So if we can also have a governance system that is integrous and can ensure we overcome this disease of corruption, then we will be able to get where we want to see with the health system.
Mm-hmm. Speaking of corruption, speaking about politics and politicians, Kwasi, I want to turn to you for a second. We obviously cannot have this conversation today and not talk about the role of political leaders, right, in their ability or inability to foster scientific research on the continent. And if there's one thing that we have observed with COVID-19 is it's shown us how reliant we are on the West, for solutions. Obviously, examples like Senegal notwithstanding, I think for the most part of the continent, we have had to rely on the West. Kwasi, why do you think that scientific and health research on the continent, given our realities, has stalled for so long? Is it really just a simple question of the lack of political will, or is it because the returns on investment are not immediate? What do you think is causing this sort of lag relative to the rest of the world?
That's a great question. I think it's both lack of political will and also the return on investment. And I just want to start by saying that a lot of funding agencies that fund African research tend to come from the West, as you rightly mentioned. But a lot of them also demand what is called counter-funding, which is that they demand that at least 20 to 50% of the funding for a particular project are generated from within African sources. Now, it's disappointing that a lot of projects end up not being funded or failing because they're not able to generate the 20 to 50% from within Africa, even though organizations like Bill and Melinda Gates Foundation and other groups are like, we'll give you the rest if you're able to raise this. And I think that one of the main issues is because of political will. Because if you compare as a percent of GDP, the amount that goes to research, Africa is doing really badly on average. But then one thing that I think is interesting is that amongst developed nations, so the US, Japan, South Korea, the private sector spends more on research than government, right? And so I was asked, well, the private sector is pretty much for profit. So what is happening? It brings me to the ROI, the concept of ROI, and why it's a bit more complex. So in the US, for instance, government research usually goes into government funding goes into like basic research, exploration, discovery. While companies usually try to take that research that has been done, and then they try to translate it, right? And so for private sector to thrive in the scientific or research world, the government must do their part, right? And so then the government will have a low return on interest, but then eventually the economies will thrive because then you have an avenue for some of these businesses to come in and to take the research that has been discovered through basic science and then make a lot of money out of it, both internally and also externally by shipping their products outside. But one other thing I think is more interesting is that in big companies like Merck, for instance, what they are actually doing is that because they're established, they are now spending a lot of money on basic research, right? And so now if you create an environment where companies thrive, they end up helping the government to pay for basic research because they know that it will help them. So I do think that like governments can do a lot. And like with the COVID-19, I do not think that we are not spending money because we don't have it. I think our priorities are just misplaced. And I think that if we do put money where it belongs, we will have a lot of investment coming in from the private sector to make it even better.
Mm-hmm. Still remaining on that topic of research in Africa, it sounds to me like what you guys are saying is that funding and promoting scientific research in Africa is almost a moral imperative for our governments, and yet it's not happening. Oyin, what are the consequences of not doing that?
So we've all seen the consequence of a pandemic on the world, and chances are that we will likely face other pandemics and other epidemics in countries or amongst countries, and Africa is especially susceptible to it because of our weak healthcare systems, and also just because of the diversity of animal life that is on the continent. And so ignoring this or not paying attention to what we need to do will lead to continuous and potentially greater health and environmental impacts that hinder progress in other fields, because as Gift mentioned, when your workforce isn't healthy, there's just nothing that you can do. You know, this feeds down into industries everywhere. And it also, because of our reliance on research from the West, we don't account for those kind of research don't account for the economic and sort of environmental landscape that is unique to African countries. And so this could lead to potential, further erosion of trust in science, as we see, because people hear, oh, they're coming to test a vaccine in Nigeria, or they're coming to test a vaccine on the continent, and it leads people to being scared. But if we know where this research is coming from, meaning it's coming from people who are invested in ourselves, coming from our African scientists, then we can improve the trust in science and increase, trust in general in healthcare on the continent.
Thank you. I want to actually quote you, Oyin, as we were preparing for this panel. You said something the other day, and you said that the biggest threat for Africa remains the loss of brilliant minds, either to immigration, for better opportunities, or changing focus due to a lack of resources. And Kwasi, and I remember you concurring, and you added, the biggest opportunity for the continent lies in our young scientific minds, and we need to create opportunities that effectively harness their potential. Now, you guys, all three of you are case in point, not currently on the continent. What do we need to do? Whose responsibility is it to make sure that our youth get into science and those who are outside come back? Kwasi, I'll start with you.
Yeah, that's a great question. I'd like to start by saying that some of the brightest minds I have met personally are Africans. So I feel that, and I think it's true. Like you come to the West, a lot of Africans who go to the West itself in the things they are doing. So inherently, we have the capacity to do well in the fields that we set our minds on. But I think there are two things we can do. The first, I believe, is mentorship, and the second is creating the environment for which whatever passion we may have would excel. So mentorship. There are two ways of having mentorship. One of them is institutional. So we have institutions like ALA doing excellent work in bringing talented Africans together to pursue their passion, kind of giving them the opportunity to do that. The second is more personal mentorship, right? So the idea that it is really important to be able to connect young Africans to other Africans or Black people who are doing well in whatever field they are interested in, so that they'll be able to learn, so that they'll be able to grow and feel motivated. Now, if we come to the concept of the environment, so when I was growing up, a lot of my teachers were like, "Oh, you're smart, and so you have to be a medical doctor," right? And I think that ends up permeating the system, and I think medicine is a very noble calling. But then I feel that there are a lot of people who might be interested in scientific research, but then we do not really have systems in place to support such ideas. And so then for such people, they end up going to clinical medicine because that is all they have. And then they have to play catch up with the West with regards to knowledge. And so if we can create systems so that a person who is interested in research can actually explore and pursue research in the context of Africa, then that's great. Sadly, there are not many options, and maybe that is why Oyinda, myself, I have to do having to do it in the US, because there are very little opportunities to do that on the continent.
Mm-hmm. Thanks, and then we'll come back to that a bit later, but I do want to shift the conversation now a little bit towards Africa-centric opportunities, Africa-centric solutions. I want to be mindful of time as well, because we see lots of questions coming through, and I want to make sure that we get to touch on all of them. Oyin, we just talk about losing talent to the rest of the world, something that I know you feel strongly about yourself. But we still currently have a continent that is endowed with over 500 million young people. So we're not losing all of them, evidently. How do we get more African youth involved in not just scientific and health research, but quality, world-class scientific and health research?
That's a great question, Veda. Like you've mentioned, I've been long very personally interested in science mentoring, which is something that Kwasi has talked about, already. And I think that this taking students and introducing them to not just what roles they can play as doctors or scientific research, but really opening their world to what you can do in the scientific world. There's a lot of career options that people are not aware of. Public health is something that not a lot of people know about. There's a lot of like data science work that is out there that is very important. There's a huge amount of space actually in science that African students are just unaware of, and that means that there is a gap. There's a gap missing in industry in Africa for these students, and so I think it's important that for the students who are on the continent who perhaps don't have the chance that myself or Kwasi or Gift had to leave the continent, it's important to create an environment where they can see what their options are in the sciences, and that involves like having like mentors who they can see, oh, this is a potential job, this is a potential path, a career path that I can take. And I think it also fosters, it's also very important to foster relationships that will build a network, because right now, what African science actually suffers from a lot is we don't have a network. So people are not aware of who is doing what where. Many scientists don't know where other scientists are and what work they're doing on the African continent, but they're aware of what other scientists are doing in the West. And that's a shame. If we can foster relationships amongst African scientists, and that will build like a network for African students to really see what is happening on the continent and really get involved, I think that's one of the most important things that we can do.
Mm-hmm. Building off that, Kwasi, encouraging young Africans to get involved in the field aside, what else can we do?
I think I would want to piggyback on what Oyinda said. I think that it's really important to have Africa-led collaborative enterprises. And I think that is what will drive Africa-centric solutions. So I think we do have some of the African-led collaborations. So we have the African Health Research Institute that used to be called KRIS. In Durban, there is a West African Research Center based in Senegal. But I think we need more of these, right? We need more of these, and then we need to kind of make those institutes visible. So that we can be able to collaborate and come up with Africa-centric solutions. So like I was talking to a close friend of mine from ALA called Yehu, and we're like, okay, so what would we want to do when we are done? And one of the things is that why don't we come up together and find ways of setting up the collaborative research institute, so that like people will come together, we train young leaders, and we answer questions that are pertinent to both Africa and the world. So that if people look at Africa and say, what does Africa have to offer to the world? We would say you have no idea, right? Because I think there's a lot of knowledge and depth within the continent. And once we find one another and we build collaborative institutions and we train our own scientists, we'll be able to offer a lot to the world.
So we talked about encouraging young Africans. We talk about Pan-African cooperation on these. I want to talk about something else, and Oyin, I want to come back to you on this one. When the pandemic was unfolding, I'm sure you saw in the news the president of Madagascar was front and center on the media brandishing a herbal cure, right, and claimed that we found a cure for COVID-19. And I think for the most part, it was met with mockery. Right, and I suppose the jury is still out on this one, whether or not is a legitimate solution. But surely the continent does have unique resources and the environment for us to start thinking seriously about indigenous solutions. Right? Is that fair to say, or am I as crazy as the president of Madagascar here?
No, that is definitely fair to say. I think it's essential that we further our understanding of local drugs and healthcare systems to build a uniquely African scientific research ecosystem. And the reasoning behind it is that traditionally, actually, chemicals in natural products have informed the development of drugs. So even many of the drugs that we know today have come from some synthesis that has been informed by natural chemicals that are available in plants and animals and just like the soil and the bacteria that are growing in the soil. And Africa is very rich in all sorts of resources. We know this to be true. And so I think that, if we can take what is available to us, the knowledge that is available to us, the local knowledge that is available, sort of traditional knowledge that is available, and provide a scientific backing to how to use these or how to like manipulate these to, to get involved in things like cancer or infectious disease care or other things like this. I think that, we could take what was a mockery of Madagascar cure and potentially come up with like an African cure that people will actually scientifically stand behind, and not just something that is like put together and like sounds like a joke to the rest of the world. And I think also even just going past the idea of drug development, if you look at the healthcare system that is available to most people on the continent, it's important that it informs how we do drug and treatment regimens. Like, we can't take what the West is doing and implement it in many parts of the continent. It's important that, if we can further our understanding of how the African healthcare system works, that will like lead to special and, Africa-centric drug treatments and like drug regimens. And because how do you account for distance to hospital, for example? How do you account for, like the genetic variation that we see? How do you account for diet variation? Like, how do you include all of this information into care for people? I think it's necessary that we definitely think of how we can further our understanding instead of just mocking what is, locally available to us, I think.
Mm-hmm. Absolutely. With that, I want to ask my last question before I go to the audience, and that question is to you, Gift. According to the World Bank, broadband connection in Africa crossed the 400 million mark in 2018, and that's 20 times what it was 8 years before that, 2010, right? Mobile broadband coverage in Africa is still at 70% of the population, so we have quite a bit of way to go. But that is a pretty amazing upward trajectory. Do you envision that this is going to pose a major opportunity for the health sector in Africa?
Yes, definitely. Healthcare is a field that can really benefit from this broadband connection in many ways. So one of them, it will help combat the whole idea of physician shortages on the continent, whereby through broadband connection, you can be able to implement telemedicine, for example, have the physician from the comfort of where they are, be able to serve multiple patients who are further away, either in rural areas or wherever in the country. And then secondly, the issue of messaging, for example. We have cases where a pregnant woman can just text, send a certain text to a call asking, is this a normal symptom for pregnancy? And we can be able to leverage that without them having to come all the way to the hospital. Or even think about mass communication, for example, with COVID. We can be able to send a simple message to thousands or millions of people saying that, stay at home, sanitize, hand wash, communication, health communication. Then there is the issue of training workforce. We can use this connection to train the workforce. We have a huge young population on the continent. So we can use that whether to train community healthcare workers and leverage that to have people trained in like healthcare skills digitally. And then the other thing will be using the research that is being already conducted in other parts of the world and building on it. We don't have to reinvent the wheel. And as Oyin said, we stand the risk of just copying what they're doing. But if we're able to learn from what other people have done and build on that using our own African-centric solutions, I think we have a lot to benefit from that.
Mm-hmm. Thanks, Gift. And I'd like to now, take some questions from the audience. I see there's a lot of questions. I just want to remind the audience, because we have limited time, so we can't answer all the questions. So instead of adding new questions, if you see there's a really good one, please upvote that question, just so we make sure that we are answering as many of them. I want to ask you guys a question that I suspect might take a little bit long, but I need you guys to be brief. And then shortly after that, I would like to invite one of our alums, Ms. Nashipai Mepukori, who's also in the health sector working in Kenya, to share a comment. And the question to you guys is the following. It's a two-part question. The first one is, somebody said in the audience that you guys are very inspiring, and I could not agree more. And the person asked, what advice would you have for a 15-year-old? While you answer that question, I want you to just take the opportunity to briefly share a little bit about your own journey, about how you got into the field of science, scientific research, health research at a young age, right? But please try to keep it brief. We'll start with Kwasi, Oyinda, and then Gift.
Okay, yeah, thanks for the question. So I'll say that science is a terrific field to be interested in, but science is also broad, right? And so I'll say that do not be limited in terms of your interest, pursue your passions, but do not say, oh, in my country, it's just usually this route we go in science. But then I don't want to also paint a too rosy of a picture that it is usually hard to pursue science in the African context. And so my suggestion will be to be proactive and then reach out to people in your field who have excelled. So like the few people, reach out to them and then get as much mentorship as possible. So when I was interested in science from a very young age, and as I mentioned before, my teachers told me that, oh, because you're interested in science, you have to be a medical doctor. But then, like, even at home, my dad mentioned to me at some point that he thought that I was probably more interested in research. But then clearly there were not a lot of opportunities for me to do that. So it was after I went to South Africa, went to ALA, that the whole journey of research began. But I'd also want to say that just a few percentage of people will be able to go to ALA. So I'm not going to say that go to ALA and then, I don't know, go do research and save the world. But I'll say that whatever opportunities that you get, make the most out of it. Like, do not stop pursuing science. And with the little resources that you have, reach out to the people that you know could help you. And you have no idea how many Africans who are doing well in their field would love to mentor young creative minds who are desirous about following this path.
Thank you. Oyinda?
Yeah, I'll just start by saying that, like Kwasi, I've always been interested in science, and I always knew that I was going to go somewhere into the scientific field. I was lucky also to go to ALA and to have the experiences that I did, and that included a lot of scientific research throughout my undergraduate experience while I was in college and university. And that has led me to where I am right now. And much like Kwasi, you know, I believe very strongly in the power of a mentor. In deciding where you want to go and deciding how you're going to construct your scientific journey. 15 is a very fantastic age to start thinking about where you want to go, but you don't need to tie yourself down like Kwasi said. I think the easiest thing actually, or easiest/hardest thing to do is to find someone, no matter how young the person is, so no matter where the person is in their scientific career. So those of us who are doing our PhD, those of us who are already professors, you know, whatever, just find someone who is willing to talk to you. And that might involve sending a lot of emails, looking into a lot of different opportunities that are available, potentially outside of your country, and just trying to see what options are there. There are a few like scientific mentoring opportunities out there on the continent as well. So it's important to do your research, try to see if you can find any of them, try to see if you can get in contact with people, and that will really open the gates for you.
Thanks, Oyinda. Gift?
I'd say, if possible, join a community that is having scientific conversations so that you're conversant with what's happening in the field. I remember when I was 15, I was part of the Science Congress in Kenya, so we'll compete in competitions just to know what's in the field and like have a thirst for knowledge in the field. I mean, there are scientific issues that haven't been unveiled yet, like some diseases that we haven't known about yet. So stay up to date with the literature in science, and as my fellows said, reach out to people, and people are more than willing to help.
There's one thing you guys haven't mentioned, but you have mentioned in the video. I would add to that, find yourself a teacher like David Scudder, right?
Yeah.
Or Mr. Jumper.
Definitely.
True. Yeah. Joining us now is Nashipai Mepukori from Kenya. Nash, we've been talking, as you know, welcome, by the way. Thank you for joining us. You've been listening in, you know, we're talking about shaping the future of health and science. we've covered a lot of grounds, but when talking about the future of health and science, what have we not talked about? What do we need to also be talking about?
Thank you, Veda, and thank you, Gift, Oyin, and Kwasi. I've really enjoyed this conversation. I'll step away from the main discussion for a moment and narrow in on two ways in which COVID-19 will particularly shape the future of health in Africa. The first is with regard to deprioritization of other critical health issues as countries deal with the pandemic. And the second is on the impact the pandemic will have on the healthcare funding landscape in Africa. So on deprioritization of critical health issues, let me share a few numbers to give you a sense of the scale of this problem as we're dealing with it now. Gift earlier talked about how malaria deaths will likely double due to COVID in Africa just this year. And allow me to add a few more figures here. So experts now say that when it comes to tuberculosis, for instance, the world could see an additional 6.3 million cases of TB between 2020 and 2025, and an additional 1.4 million deaths. I mean, that's huge. And we've also seen the impact of the pandemic on, basic immunization, right? So routine vaccination has greatly reduced or come to a halt in certain regions and countries. This will mean that children will be exposed to fatal and debilitating diseases in coming years. And this is entirely preventable. So we could see, for instance, an uptick in cases of measles, polio, and other vaccine preventable diseases. And this is something that I'm particularly worried about. Finally, I've been tracking very closely the impact of lockdowns on access to contraceptives, maternal and child healthcare services, and worryingly, the increase in gender-based violence, which is particularly tragic. Again, this is another issue that I think is being ignored, and we really need to tackle it if we don't want to see, consequences down the line. So just as economies have taken a blow because of this pandemic, healthcare will also take a big blow. And my advice would be for those of us who work on certain issues within health, be it maternal health, cancer, TB, polio, whatever it is, we cannot abandon our issues right now. We must continue to ensure that they remain in the spotlight even as we, focus on dealing with this pandemic. And on my second point, and this is with regard to changing funding landscapes in low and lower middle income countries, experts are now predicting that just as economies have taken a hit due to COVID, so will availability of health funding. So the post-COVID-19 world will likely see heavily reduced donor budgets in our countries as part of austerity measures in high-income countries. The UN, for example, recently called for a $2.5 trillion coronavirus crisis package. And I don't think this funding will be available. Already we've seen the US under Trump withdraw funding for WHO. The US contributes typically about $400 million to the agency which every year, which is about 15% of WHO budget. So when this funding is withdrawn, we'll see a big impact on the big three, HIV, TB, and malaria, and especially in Africa. And then we're also likely going to see that philanthropists and foundations will step in to fill that gap. For example, the Bill and Melinda Gates Foundation. So the Gates Foundation already has a disproportionate influence on health decisions in many African countries, as is, and I predict that this influence will only grow in the post-COVID-19 era. I mean, I think relying on well-wishers and foundations in such a significant way is not the model that African health systems should depend on. We need homegrown, sustainable solutions, and that's why I've really enjoyed the conversation today to see what myself and other young leaders who are interested in healthcare, what we can do to make sure that we're coming up with solutions that work for Africans. Now, I know I've talked a lot about the negatives, but I'm really hopeful that on the flip side, COVID-19 will allow Africans to reimagine healthcare and what our countries can achieve without over-reliance on high-income countries, and hopefully reverse colonial trends in global health. I think that will be one of the biggest wins for the continent. Thank you.
Thank you, Nash. I just want to remind our audience that Nash is also an ALA alumna from the class of 2010. She's currently a manager at Global Health Strategies, which is a consulting firm in the health sector. Tons of questions, guys. I'm going to prioritize some. The first one is, Gift, you talk quite a bit, not a lot. You talk quite a bit on this issue. So I'm going to bring in another voice on this one. And Oyinda, I'm going to bring this one to you. Somebody asks, who's responsible for health equity? And I'm going to tie that with another question that somebody asked, which is, what about those living in rural communities who have limited access to health services? What can we do for them for more prompt healthcare provision? It seems that very often there are long waiting lists. So what can we do? And tie that to this idea of how do we fix and who is responsible for health equity?
Those are fantastic questions. Very difficult questions to answer, of course. I think that the person or the people who are most responsible for health equity actually is everyone. So that includes like requiring a lot from our government, but also asking for private investment as well, as Kwasi has talked about a bit. I think we should realize that this is a solution that can only be based in community-wide participation. It's imperative that everyone takes good account or like plays a role in trying to further health equity on the continent, and that would mean coming up with solutions that we might not see outside of Africa, and that ties back to the question of rural areas. What do we do to improve health equity in rural areas? This will involve very specific, very Africa-centric changes, and that could come from community health workers, training people in the community, not as doctors, of course, but as people who can deal with the most basic of stuff. Taking into account communication, public like mass communication. How we can spread information and how people can also ask questions or make changes that way, or ask for certain requirements like booking immunization schedules for an entire community that is sort of distant from a hospital, and coming up with solutions like that. I think it's important that everyone plays a role, because if we don't push our governments to invest in health equity, it's eventually going to come back to us. So even those of us who live in big cities, we're eventually going to see the ripple effect of not providing health equity from the villages all the way into the big cities.
Thanks, Oyin. That was very, very well articulated. Kwasi, I'm going to give you two questions, but which are very related, and I want you actually to give me as honest an answer as possible on this one, because it's an important one and it matters to people. Somebody asks, what do you think needs to be in place for you, all three of you? And I assume that Oyinda and Gift don't mind you speaking on their behalf on this one. What is it going to take to bring you guys back and thrive on the continent? And then somebody else asks, related to this question, can you have a significant positive impact on the African healthcare system while being outside of the continent?
That's great. That's a very good. Yeah, it's a very good question. I don't know if the ALA Fund founders are listening, but
I think they are.
To be very honest with you, I think that it is a very difficult topic. It's a very difficult question that I have been thinking about and have been thinking through. My research involves using very specific technologies, and I think Oyinda as well. And probably Gift, the idea being that we feel that we are more productive where we are now in the space we have. And it's not even the concept of it being in the US or anything. If I was in a different state, I probably would not get the resources I have now to do the research that I want to do. And even on the flip side, I was reading about COVID-19 in Uganda in terms of their response and their reagents. And apparently it takes about 2 to 4 weeks for them to get reagents. I mean, in the US, at times when I place an order and I fast track it, I get it in 3 days, right? And so there are a lot of things that could retard our progress when we come to the continent. And I think tying it back to the second question, which I think is very important, is that can we make positive impact whilst not on the continent? And I think the answer is true, but with a caveat. I think that we can answer Africa-specific questions whilst on the continent, but I think it is more important to be able to set up institutions on the continent that partner them with institutions in the US or institutions in the West. And so I think that is kind of what I'm trying to drive at then is, if it is very difficult for me to move everything and then come to the continent without any ties to the US for me to be effective in my work, then maybe it is more important for me to find ways of collaborating with a US institution or a UK institution in Africa, right? So that we can have it tied back to the US when it comes to reagents or scientists or whatever we will need. I think this is probably true for many scientific industries as well. But the question of going back to Africa, I think, is on all our hearts. ALA students want to go back to Africa. ALA students want to answer questions that benefit the continent, but we also want to be realistic on the approach, right? And I feel that for at least myself, the realistic approach will be to find ways of having institutions in the US that back institutions in Ghana, and maybe me being a bridge to that.
Oyin and Gift, thumbs up. Did he do a good job answering on your behalf? Yes? Wonderful. All right. I'll take two more questions. They are the popular ones right now. One is from one of your classmates, Rumbidza Igondo. She asks, what steps should be taken to mainstream and inject the latest R&D innovation? Oops, what happened to my screen? Somebody moved the question. She was asking something about, I've lost that question. All right, I'll move to the next question. The second one was from Amani Tinkasimile, and he says, it is my understanding that biomedical research and validation take time, and ensuring public safety with ethical execution is critical in avoiding abuse, adverse effects, and fatalities. So what is the panel's take on the validity of the test kits testing and reporting of COVID-19 cases, as well as the idea of having a fast-track vaccine offered to human subjects in Africa or elsewhere? Oyinda, I'll give you this one, and I'll ask the next question to Gift.
So there have been a lot of talk about the validity of the different types of kits that have come out all over the world. Some coming in from China, some from Korea, some from other African countries that have developed their own testing kits. I think what is most important is not everything is going to be equal. And so that means that not all tests are equal, even if they all came from the US, even if they all came from like US agencies or US like research labs or whatever. Not all of them are going to be equal. Not all of them are going to answer questions the same way. What is important though is being able to reflect that truthfully. So taking a kit and being able to reflect just how well it predicts COVID testing versus not, truthfully to the public, not keeping things hidden. So even if your test is only 50%, accurate, and so it's accurate half the time, it's important that people are aware that that's the case. So if it's required that, okay, it's quick, but it's only accurate half the time, then we do a quick test, but we also have a backup system of confirming those tests. That is what is required. I think what is missing in a lot of these cases is that no one knows the truth across the different tests. So there's some hidden information that then loses public interest, and that loses public trust, and that's the problem. I think that's the major problem. Sorry, I've like completely lost the second part of the question.
I think you've answered it quite well. Thank you. Gift, I want to bring you Rumbidza's question now, which is what steps should be taken to mainstream and inject the latest R&D innovation of our African health scientists? Public-private partnerships, maybe? Any other ideas on that one? How do we bring R&D innovation?
Yeah, I definitely think that public-private partnerships is one of the ways that could help in encouraging this research on the continent, and also find a way of bridging the gap between the African talents in the diaspora and the upcoming young scientists on the continent. I think that can be like a way for long-term having that the focus moving on the continent rather than having them staying here. So either way, public-private partnerships, but also developing mentors on the ground using people who are already in the diaspora and have experience in the field at the moment.
Mm-hmm. I'm going to ask you one last question from the audience, and that goes to you, Kwasi. The question is, the backbone of research is data, obviously, right? How can African countries raise the capital needed to build well-integrated data in EHR that will support sustainable and reliable research? Any thoughts on that?
Yeah, so I think the concept of reliable data is a problem, even for the West. So a classic example is during the COVID-19, there were 2 landmark papers that were published in medical journals based on fraudulent data, right? It was on the hydroxychloroquine trial. And based on that data, WHO decided to suspend the hydroxychloroquine trial. And it took scientists to look at the source of the data and say, this is fraudulent. This is coming from a company in California that is not even trustworthy. And now the WHO decided to continue the hydroxychloroquine trial. And so I think the concept of good, reliable data is an issue across board. It so happens that when the data originates from the West, it is a bit more believable than when it originates from Africa. But then I think that it's then very important, especially as engineers, to think about ways of collecting data, ways of trimming data, ways of normalizing data in such a way that is available to everyone. And I think it is a bit difficult, especially when it comes to data from clinics, knowing very well that some rural areas might not have that available. And so I'll probably say baby steps, finding the data we can get from the large hospitals, having people who can volunteer and go to clinics. Maybe we can start with manual data sets that we can convert to electronic data sets, right? Having portals available so that whatever data we have is publicly available. Because at times when I'm doing my science and I'm looking for data, I use American-based data. Because it's very difficult to get Africa-centric data sets. And so having those things freely available so that people can be able to use those data sets. And being also doing some computational work, I can see that it is hard to do that, but then to be able to find ourselves in situations where we can reliably answer questions, we need that data available. And I think we can get that. And I think the last thing I would say is also the importance for interdisciplinary work. So we need computer scientists who want to work in the space of medicine and biological research to get this thing to be done.
Absolutely. So we're coming to the end, and I want to leave you guys with one question, and I need you to give me a 10 to 15-second response. When we are having this panel again at the ALA Golden Anniversary, so 50 years of existence, and you guys, you'll do the math how old you are, and you're telling us how you have individually shaped the future of health and science. What are you telling us? What have you accomplished? Kwasi.
Okay. I would say that I've helped develop technologies on the continent that cut down hands-on time and also is more affordable for the treatment of illnesses. So more on the engineering technology side.
Thank you. Gift?
I'd say I have merged entrepreneurship, data science, business, and healthcare to make it accessible to the underserved populations.
You know this is being recorded, right?
I know.
Oyinda.
That's my best.
I will say that in that time that I've mentored a large number of potential scientists and that we can see the things that they're doing on the African continent.
Thank you, guys. May you all continue to dream big, take action, and change the world. With that, I want to thank everybody. I want to call my colleague Khalalelo to say a few words. It's been a pleasure hosting this. Thank you very much, everyone.
Thank you.
Thank you.
Hi, everyone. I am Khalalelo from South Africa. And as Veda said, I'm the coordinator for the Executive Speaker Series here at ALA, which now happily includes the Redefine Expectations webinars. On behalf of ALA, I'd like to extend a few rounds of gratitude. Firstly, to you, Veda. As our host tonight, you are evidently in your element here, and you made us all feel a part of the conversation, which is something really special. So thank you for that. Oyindamola, Gift, and Kwasi, you are exactly an example of why this series was important to produce. Your work is inspiring, and we cannot wait to see what lies ahead of you in the spaces of science research and public health space. So thank you very much for taking the time to speak to us today. And to the rest of our attendees, we hope to see you back here again in exactly 2 weeks. So on the 25th of June, for our next group of fantastic ALA alumni that are sure to redefine what young people are doing, and this time in the space of governance and advocacy. I'd like you to keep an eye out on our social media pages and event platforms like Eventbrite. So that's www.ala-ess.eventbrite.com, or just search for ALA and the Eventbrite, and you can find the rest of the series there. I invite you to please share with your circle as the series is open to everyone across the globe. But otherwise, for myself and the rest of the team, thank you very much for joining us tonight. Goodbye.